Good evening. I am Dr. Matthews. You're more than welcome to call me James. Welcome to the sleep clinic. It's rather like a regular clinic, except we specialise in treating insomnia and all manner of sensory conditions, actually. So, while I put these gloves on, maybe you can tell me a little bit about how it is you've come to have trouble sleeping, how long it's been going on for, and what kind of bedtime routines do you have? Okay. And what kind of work do you do? Does it involve screens, the internet, using a computer? Yeah. Okay, what about your leisure time? What does that look like? Exercise? Morning, evening? Yeah, it's a very common problem. People don't have time to exercise until after work, so they have caffeine in the evenings and then wonder why they can't sleep at 3 o'clock in the morning. I mean, exercise is fantastic for wearing you out, but when we choose to exercise is actually quite impactful on our alertness levels. There we go. So, that's the gloves on. Now, during the exam, I'm going to be touching your face and scalp and also shining some lights in your eyes. I'm also going to have to come quite close at times, so it's just a warning in advance. You're obviously very safe here and you can trust me completely. Alright, the first thing I'm going to do is check for any prior injuries, any redness, soreness on the scalp region or sort of around these parts of the head. Any bumps or scrapes or bruises in these areas, even if it's a while ago. Sometimes the residual effects of injuries can actually have longer lasting consequences than you may think. So a little bump here. Yeah, I can see that. And then there's a little, I guess that's a scar on the top of your ear. From when you were younger, okay. We all have scars. This one right here. Yeah, that's from a burn. Even doctors get injured. Okay, just pop your head forwards if you could. Alright. Does that cause you any ongoing pain? Do you suffer with headaches from time to time? Alright. Just gonna give you a few instructions on your on things to do on your face. Some of them might seem silly, but just follow them as best you can, please. If you could close your eyes for a start. Okay, now furrow your brow. Okay, you can open your eyes now and raise up your eyebrows. If I press here, just above your eye socket, is that particularly sore or tender? No? What about over here? Okay, I'm gonna press lightly down either side of your nose. Is that sore or tender? Okay. I'm now gonna feel just behind your ears and around the lymph nodes on your neck. Okay. Is this particularly sore or tender? Good, okay, on this side. If you could just gulp for me. Big gulp. One more time. Okay. Just going to use a tongue depressor to quickly look inside of your mouth. Say "ah," please. Have you had tonsillitis before? Have you had it recently? Okay. Yeah, sadly you have to have it an inordinate amount of times before they'll offer you removal of the tonsils. It's actually quite an invasive procedure, so it's not something they just dish out. Well, they used to, but now you have to have it at least, I think it's 10 times or something really crazy. Yeah, they look a little sore actually. Haven't had any coughs or illnesses recently. Corona. No, okay. Teeth look to be in good condition. Do you brush and floss them? Good. Okay. Now let's dispose of this. I'm going to do a quick temperature check. Let's grab the thermometer. Once again, if you could just open your mouth. I'm just going to put this under your tongue. It will just take a minute to take a reading. Good, that's normal. Alright, I think we should listen to your heart and your lungs, your breathing. Do you smoke? Okay, so just socially, but not every day. Good. Well, I mean, it's not good, but it's better than being a full-time smoker, I guess. Apologize for the cold end, but it should warm up very quickly. Okay, I'm just gonna come down this little part of your top here. Try and be as non-invasive as possible. Alright, I'm gonna start here. If you could just breathe normally, okay? Just breathe very normally. Okay, now if you could slow your breathing. So, small pause, about 3 seconds on each. It's gonna come over this side. Okay, if this time you could take a big deep breath in and just hold your breath. And over here. Keep on here. Okay, and let it out. Once again, big deep breath in. Hold it. Okay, and let it out. Okay, I'm just gonna come come around the back and do the same thing, okay? Just give me a little cough. Okay. And over here. Okay. Really big deep breaths in now. Really filling up your lungs, expanding all of your lungs. Okay. No obstructions there. No difficulty breathing. Okay. Let's do a quick heart rate check, okay? Wrist or neck? It's entirely up to you. And we'll start here, okay? Just gonna find your pulse and then count the beats in a minute. Okay. Please try just to relax and breathe as normally and relaxed as you can. Ready? Good. That's about 76. Do you know what your normal resting heart rate is? Okay. Hey, if you get a chance, these are sports watches, smartwatches, very, very good. They count your steps, keep track of your heart rate, even monitor your sleep. I really recommend them if you're in any way interested in your health. I'm going to take another pulse reading off your wrist, just to make sure. Okay. Again, just try and relax as best you can. $73 there, that's good. Just gonna write a couple of things down. And now, a lot of time when struggling to sleep, it's due to oversaturation or excess light coming in. So, disrupts your body's circadian rhythm. This is how your body measures when it should be awake or asleep. Obviously, electric lights are a relatively modern phenomena. That means our ancestors had to rely on the sun being up to tell them that it was the day, and when there was no light and the sun was down, that's when they would sleep. And this is built into our DNA. It's an evolutionary hangover. So when we sit up all night watching Netflix or looking at screens or tablets and taking in excess light, it sort of tricks our body into a state of alertness that, we think it's the daytime. So, as strange as it feels at first, a really good technique for helping sort of set your body up for a good night's sleep is to really minimize the amount of stimulation that's coming in. So, it's okay to have a landing light or a small light, but try and turn everything off. No sounds or maybe some background noise like a rain or ASMR. But nothing invasive, definitely no music. And turn all the lights down, all the screens off, and you will start to notice after a few days, maybe a week, that this is sending a signal to your body that it's time to relax and sleep and chill out. It really does work, okay? On that note, I'm going to check a little bit of your eyes, okay? you can just pick a spot over my shoulder, or you can look at my ear if you want. Okay, just focus here if you could. A little bit of light coming into your eye now, but it should be over very quickly. Okay, just look up. And look over to your left. And over to your right. Back to the center. I'm just gonna place my hand on your upper eyelid, okay? If you could look up and left, up and right, now down and left, down and right, back to the center. Sticking with this eye, just focus on my glove, and now focus on the ophthalmoscope. Glove, now focusing it, okay. Do the opposite eye now. Again, I'm just going to place my hand on top of your eyelid and just gently pull up. And then moving closer, okay. Looking to the left. And now to your right. Looking up. Looking down. Looking back to the center. And focusing on my finger. And on the ophthalmoscope. Finger, ophthalmoscope, okay. Just going to use an eye paddle to block your vision on one side. That seems to be working pretty well. I'm just going to switch the head on the ophthalmoscope. 1 second. Okay. There we go. Now this just allows me to change the aperture on the lens that I'm looking through, which means that I can focus better on the back of your eyes and adjust for different distances, rather like a camera lens. Okay. You could just pick a spot behind me. Maybe the monitor on the wall. It doesn't really matter as long as it's kind of somewhere in that general direction. You have a very nice eye colour. It's especially up close. Lots of beautiful patterns. Do you get compliments on your eyes a lot? Well, I'm sure people think it, and they're probably just too shy to say. Okay. I'm just going to put some colour filters in front of your eye. Just keep fixated on a spot near the wall, okay? Somewhere over there. Just looking that way. See, some particular blood vessels show up clearer under different colours, and some are invisible, which helps me to hone in on the ones that I'm looking for. Okay. Just looking that way. Okay. There we go. Okay. I think I'm going to take the room lights down slightly and then have you read some letters and symbols off the monitor on the wall, okay? Alright. Okay, there we go. Nice and dark in here now. I'd just like you to focus on the screen at the back, okay? I'm gonna flash up some numbers and letters and symbols, and I'd just like you to look at them, identify what they are, and then in a moment we'll move on to some word association, okay? But firstly, we're just going to check you can actually see and identify what's coming up, okay? Alright, so just read back the letters on the screen, starting now. Yep. Yep. Good. Very good. Doing great. Yeah. Good. Good, good. Very good. Yep. 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 Good. So vision at distance is working just fine. Okay. Now I'm going to put up some words on the screen, okay? Or maybe some images, and I want you to tell me the first thing that pops into your head that you associate with it. Now, obviously don't say what it is. Like if I were to show you a picture of a dog, don't say dog. You could say cute or fluffy or, adorable, that kind of thing. You understand? It's pretty simple. Okay. Ready? So, what do you commonly associate with this? Okay. This? Yep, I'm going to write these down actually. And this. Interesting. This. Okay. Common association with this. What about this? And a common association with this. Okay. What's the first thing you think of when I show you this word? Alright, and this word. And lastly, this word. Okay, good. Happy with that. Just gonna take the opportunity while we've got the lights down just to quickly shine a light into your eye under lower light conditions. So, back to the ophthalmoscope. You can stay looking at the chart if you wish. Do you drive? Okay. Ever have trouble seeing signs off in the distance? No, that's good. You shouldn't be driving if so. Okay. Just going to shine a little red dot onto the back wall. If you could just track it with your eyes, okay? Can you see the dot? Just tracing the dot wherever it goes. We're just checking your eye's ability to track, but incidentally my cat loves this. It's literally her favourite thing in the world. Okay, I'm just focusing on the dot. Wherever the dot moves. Good. Tracking seems absolutely fine. Alright, I'm going to pop the main lights back on now, okay? Just blink a few times. Just reacclimatize to the light. Good. You did very, very well there. We're slowly moving through your senses and making sure they are 100% operational, and you're doing great. Just going to check the nerves in your face and around your scalp and neck region, okay? This is a very, very easy test. I'm just going to have you close your eyes, no peeking, and I'm going to very, 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 very lightly just touch you with this brush, and I just want you to point to whereabouts on your face you feel the brush, okay? Again, no cheating. It's just making sure all your tiny nerve endings in your face are firing as they should be, okay? Okay, good. So eyes closed. Ready? Good. Just point to where I touch, okay? Good. 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 Doing very, very well. Just point to the area that I touch, okay? Okay, a very similar test. I'm going to ask you to close your eyes again in a second, but this time I'm going to touch you with the sharp end of the brush. I say sharp, it's not sharp, but it's sharper than this blunt stick here, okay? And I just want you to tell me if I touch you with the sharp or blunt stick, okay? Just say sharp or blunt. Alright, eyes closed. Yep. Very good. Good. Yep. No peeking. Good. 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 Okay, you can open your eyes. Doing very well. I'll briefly check your hearing before I move on to your reflexes. Do you struggle with hearing people speak at all? No hearing aid? Good. Listen to loud music a lot? Okay. Well, it tends to be the top end that we lose first, the treble. That's the definition in people's speech. So, in order to test your hearing, I am going to first hold my gloves by the sides of your head, and I'm going to very, very gently just rustle them, but quieter than that. And you just tell me left or right, okay? Now, some are going to be easy, some are going to be harder, so ready? Good. Good. I'm also going to move the gloves further away, so it'll be harder to hear on sometimes, okay? You're doing very well. Just say left or right. It should be outside of your peripheral, but I'd prefer if you closed your eyes, just to make sure that you're not cheating, although really you'd only be cheating yourself. Good. 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 Okay, this time I'm gonna start and continue to rustle my fingers together, but I'm going to move them further and further away from your ears, and I just want you to tell me when the sound fully decays and you can no longer hear it, okay? Alright, so we'll start on your left side, my right. Okay, ready? Just tell me when you can no longer hear it. Good. Alright, same on this side. Just tell me when the sound fully decays. Good. Going to do both ears now. Just let me know if one is earlier than the other. I'm going to try and keep them as uniform as I can, so This should highlight any imbalances in your hearing, okay? Good, doing very well. One last time. Good. One last hearing test before we move on to your reflexes. I'm gonna whisper some colours into your ears. I want you to just shield your vision or close your eyes if you prefer, and just repeat the colour back to me, okay? Start on this side, okay? Ready? Red, green, blue, yellow, white, orange, purple, orange, red, lime green, neon red, pink, purple, blue, sky blue, auburn. Very good, I think that was 8 out of 9, possibly. This side, okay, ready. No peeking. Ruby, blue, deep blue, black, white, beige, orange, green, turquoise, green, blue, yellow, bright yellow, pink, grey, black, brown, brown. Very well done. I'm just going to write the results down. So far it seems like you're all there sensory-wise, which makes me think it's probably habitual or situational that's causing the insomnia, and also could even be down to things like stress. In fact, stress is one of the biggest factors. We're very quick to medicate, and medicine is obviously terrific, but sometimes lifestyle changes can help a lot more than medicine can in some situations. It should at least be the first port of call. Okay. Lastly, we're going to do your reflexes. This just involves a little hammer. Just going to lightly tap various points all over your body. I'm going to do it very softly, okay? And there should be a little reaction, okay? Should be, as long as everything is working alright, okay? Ready? So you're going to start with the pressure points in your shoulders. Good. 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 It's one at the back of your neck. If you could straighten your arms out. One at the back, one at the front. Good. And over here, one at the back, one at the front. One at the back of your wrist. And one at the front. Good. And this wrist. Good. Good. Doing very well. And the one that everybody knows, if you could just scooch back into your chair, make sure the back of your leg is touching the chair. This one's the neon, everybody's favourite. Ready? Good. Good. And back of your ankles now. Foot up. Good. Good. Alright, so as I say, it seems like medically you're perfectly fine. A little bit of inflammation in your throat, but I don't think that's the reason that you're struggling to sleep. I think we should examine your nighttime routine. I also think getting together some kind of playlist of things you can focus on or sort of use to zone out noise. So things like rain or white noise for some people, or binaural beats, or even ASMR is something that you're not exactly focusing on it, but it's leveling out the amount of noise. Sometimes if it's completely silent, any noise that there is can stand out and draw our attention to it, but background noise can sometimes help mitigate that. That's one thing. We've already talked about the eliminating television, bright screens, this kind of thing. Another thing that I would suggest is blue filters. So there's research to suggest that blue light that enters your eyes can exacerbate alertness in the evenings, and by filtering it we can protect ourselves from that. So maybe look into some blue light filters on apps if you are going to be using your phone. Modern iPhones come with a mode already built in. Okay. I'd also maybe look into some guided hypnosis or sleep inductions. These are just fancy names for someone helping you to relax. So they would sit you down in a chair or your bed and take you through breathing exercises. They would slow your breathing down, make sure that your arms and legs are all kind of floppy and all the heaviness is sort of lifted out of them. It helps to focus on that rather than just kind of being alone with our thoughts. It's almost like counting sheep, that kind of mentality. Now you can get audio tapes. We offer services here for guided sleep inductions, so anything you like really, but it's something that I would strongly recommend and has helped me over the years in relaxing and getting to sleep. And once you find that person with that perfect voice, the one that you just hear and instantly sort of doze off to sleep, it can really change your sleeping life from poor to refreshing and healthy. And that's what we're all about here. Okay, so I'll look into referring you to a sleep inductionist, someone that's going to help relax you and walk you through a sleep routine. Okay, yeah, of course we can do that. That's no problem. Yes, well, this has been a great first session. I look forward to seeing you again and completing your treatment, and I look forward to improving your sleep. Great. Thank you so much for coming in. Thank you.